Ooh, Riley. Funny videos Trump meme. Let's see. That's a good question, Riley. So I still haven't found a place. I'm really stressed out about it. And because you are on my live stream, I think I'm gonna be buying an RV and living in a fifth wheel for a few months before we decide to jump into buying a home. Because I did want to buy a home, honestly. My wife has a pretty decent income, so with my measly income, we can definitely get something nice. And that's the initial thought. But for now, I think right now I'm looking for fifth wheels. So I'm gonna live in the fifth wheel. You guys heard it here first. We'll see if that happens. I'm still gonna fly out and look for apartments next month, but I'm liking the fifth wheel route right now. So just a heads up. What are you doing, Riley? Have you decided? Diana, ¿cómo estás? Good to see you. Good to see you. Also, Riley, so with the physician loan, so my wife is in the military, so we were also thinking of either doing physician versus VA loan. So we'll kind of see who gives the best interest rates. Initially, I thought VA was going to be better, but physician loans have what are called variable interest rates, and the problem with the variable interest rate, it could be higher or lower, within a certain range. So if you do that, it actually might be better rates right now with how the market is. But yeah, I guess whenever we decide to jump onto that boat, I'll be able to talk more about it. But that's kind of our initial VA versus physician. It seems like physician might be a little bit better right now, but over the long run, who kind of knows? We can always refinance into a VA loan later, though. So looking at SMP's revision to med school. Happy to see you here heading into residency, my friend. Thank you, Diana. Yeah, I know. I'm so happy. It finally happened. Oh man, I had a great year. I had a fantastic year of interviews and everything, and I'm just super happy to go to the program I wanted to. That's just crazy. VA loan, yeah, VA has no down payment. Physician doesn't either, MX. That's a thing. Literally, VA and physician loans are super similar, other than VA is fixed interest and physician is variable interest. That's literally the only difference. You don't need a down payment for physician, and you also don't need to pay PMI with physician, and the same for VA. Yeah, Diana, I plan on keeping on sharing it. Yeah, I don't know if you're subscribed to my newsletter, Diana, but I think that's probably the best, where I'm gonna post more things on that, on the email newsletter, just because I feel like that's a lot lower stress than making a video or something. Riley, sounds like a good plan, fun and unique. I'm currently third year medicine in Reno, so I still have a year. Nice. Are you planning on going into family, Riley, or what's your thoughts right now? Yeah, I think it'll be cool. It'll be interesting. I've never lived in an RV, but it's just gonna be me moving up there for the first few months, and I don't need anything huge. I hated apartment living, and here at the house, all I use is literally the kitchen, my computer, and my bed. I have this massive house. The dogs are probably gonna stay here with my wife's parents, and then we'll ship them out whenever we get a house and a yard and things for them, But that's kind of the plan right now. Oh, the thumbnail didn't work. Oh, the thumbnail's awful. Hold on, let me see if I can change it real quick. Oh, this is a good one. Emergency medicine, nice. I'm not sure if you mentioned that. That sounds familiar. Sorry if I missed that, but EM, I think, oh man, EM is in an interesting spot with what happened last year, and then it got a little bit worse this year. What are your feelings on emergency? I'm not in that world, although in family, you still kind of are. I don't know, a lot of the T and other stuff that's going on, I guess, in the EM world. Tell me about it. It takes a lot of stress of matching out, to be honest. But yeah, I hear you, Riley. So Diana, basically what's going on this year, emergency medicine had 555 spots open. Like that's how many spots went unfilled in emergency medicine this year. So which is interesting because it's a little bit higher than last year, and last year was bad, and it's a little bit worse this year. And kind of the idea is like emergency medicine is getting saturated, kind of deal. So I don't know all of the tea, I guess, but people are concerned like over long-term prospects, which I don't know. Like I truly don't know. Like in family, I guess for me, it's like the mid-level like creep, but I'm like I want to do a surgical OB, so there will never be a mid-level that can do that at that level. So I'm not like too concerned about it. But I can see why some people in like family medicine are a little bit more. Hey, sir. Currently, pre-med took a year off to join the Air Force. Starting calling the fall to finish my rerex and undergrad. Awesome, Abdi. My wife is in the Air Force. So awesome job, man. Definitely try and get like that military scholarship and have, debt free. Like kind of it depends on what field you want to go into. Like if you want to go into primary care, like OB, family, emergency, and I think general surgery is still pretty good. Like you can match pretty good within the military, but like more specialized specialties, it might be a little bit hard for you to get into residency because if you do the military scholarship, you can only apply to military residency spots. Diana, oh yeah. Nice, Abdi. Perfect. That works. Sounds good. Oversaturation comes from contract management groups creating residencies to increase the supply. Yeah, the thing with that, Riley. So it's what happens is family medicine residencies are super easy to like approve, like to get started, and the second easiest is emergency medicine. So what hospitals will do is they'll create a family medicine residency, and then they'll like latch on an emergency medicine onto it because it's easier once you get the first one. And those two are like the easiest kind of thing, but I hadn't really heard of that. Are there a lot of private emergency medicine residencies, Riley? I don't know. It's allowing decreased wage and control schedule more. Plus, there's a continuous scope creep, but I feel like that's true in most specialties. Yeah, yeah. I mean, that's the reality of it, but whatever. I feel I don't know, not the best feelings. I was looking at how long it takes, like for a nurse to become a nurse practitioner. It's basically like a 1 year program, which is kind of crazy to me. It's like 400 clinical hours. Like in medical school alone, we get 5,000, and then like another 5 or another like 10 in residency before we're allowed to practice on our own. But that's just just my thoughts. Short program and it's all almost time. Plus, you learn from news and launches. Yeah, exactly. Like the physiology, they don't learn like the physiology. Like honestly, they just learn kind of like protocols and treatment plans. But I think mid levels I think are okay with like normal difficulty patients, right? It's like whenever they get more acute and complex that I don't think a mid-level should be taking care of those patients at all. And I think they can do like a lot of bread and butter primary care, but then if it gets like a little bit more complex and chronic, then I think you need a doctor. Nursing theory too and research. Yeah, see, I don't know much about it. I just know like the training is really short and they have a really strong lobby group. So that's kind of all I know. So general surgery military, you have greater chance of matching compared to the civilian sector. Is that true, MX? Is that a question or is that a statement? I don't know. That's why I can see like general surgery being pretty needed. And what's kind of cool and like in that, like I loved trauma. I think I've told you guys many times I loved trauma surgery. Like I think the military like would be the perfect general surgery into trauma surgery kind of path. But that's cool. Yeah, I can see that. Oh, I see. Yeah, I don't know. I don't know if it's. I don't know how that goes. Uh, One of my friends did family medicine, and he matched. He's going to Florida for like a military family medicine residency. And then another girl. She's not like my friend. She's an acquaintance. She is doing OBGYN, and she's military. Um, Planning on doing special operations surgical teams in the Air Force. I don't know what that is, but it sounds really cool. There's also this really cool, like if I commission with the military, there's like this really cool where you literally are kind of like guard, but you work only 3 weeks, and it's like they send you somewhere where they need help, and you do all your like drills over 3 weeks, just like taking care of people, which is like super clinical, as opposed to going every month and doing drill, which is all the admin crap that you have to do, especially like as a doctor that commissions into it. Hey guys, I made some coffee real quick. Let me go prep it. Let me go prep my coffee real quick. You guys will see me in the background. Ask more questions. Hit the like button. All right, that's pretty good. French press coffee? No, just regular like coffee, like quick, like not instant, but drip coffee, Keurig cup style coffee. Tea man myself. I hit the like button. Thank you, thank you. Oh, yeah, guys, I'm just chilling. If you guys follow my newsletter, I've been cooking a lot. Today, I cooked a really good. Let me see if I can put it up on the camera. So we made like a chimichurri sauce, as well as like roasted asparagus, but that's like super easy. And then while the class was going, I baked some lamb chops. So I don't know if I'll be able to see that. Maybe if I turn this thing off. Let's see. Yeah, not very good. Basically, it was just like lamb chops with some chili sauce. Came out super good. The chili sauce is a little bit bitter now. Like I just had some more and it got more bitter. Coffee this late, just practicing for residency. Yeah. I always drink coffee. Doesn't matter time of day. I do drink too much coffee. Probably. We'll see if I chill out, but probably not. I like my lamb chops well done. Oof, I love lamb. That's my favorite meat in the whole world. Lamb chops are the best. I have a few videos out on it, Abdi, on why I chose family med. So go watch those and leave a comment on those videos. But basically, long story short, is I really wanted to be a pediatrician when I came into medical school, and and then I started my third year rotations, and then I loved OBGYN. When I was on my first C-section, I was like, this is the most badass procedure in the world to save both a mom and a baby was just like the best thing in the world to me. But at that point, I didn't know that family medicine could actually perform C-sections and do surgical OB. And I told my mentor that he was an OBGYN. He was saying, he's like, you can do this in family med. You just have to do a fellowship. So then it was like super easy for me to decide then because I can take care of the babies, the peds. I can do the C-section and the labor and delivery. I love delivering babies. And then I can also take like the elderly, like the full scope. So it was like really, really easy for me to decide. Also, I just had so many experiences like in rural New Mexico. I would go out and do rural rotations. And at one of the hospitals, the family medicine doctor was running the ICU. He let me put in central lines, intubate patients. I was admitting patients up from the ER. And I didn't get to work with him on labor and delivery, but he would also perform the C-sections at the hospital if needed. And that is one family medicine doctor that was doing ICU, inpatient medicine, and labor and delivery unit, like all him. So it's just badass. You can do that all with the right training and easy. So can you be able to relocate to another state when residency is done? Nope. You could probably get a license in any state. Long as you pass board, I think you should be okay. I don't know the full details on it. I'll let you know when we get there, but yeah, it should be transferable to pretty much every state. Yep. Should be. Should be good to practice anywhere I want in the United States, and honestly internationally too. Like at that point, when I'm done, I can even do international. Like I've always wanted to do Doctors Without Borders, so I feel like I'll do Doctors Without Borders at least once in my career, hopefully. First year med school hard. Anyway, it's not fall behind on making a schedule and keeping to it. Not really, Diana. Like honestly, first year really sucks. You kind of have to learn on how you study and how your professors, teach and the way they test, and every block is different. So it's kind of sucks. I feel you. I got into a really good rhythm of, you've seen all my Anki videos. Like I literally just started doing Anki and standardized practice stuff instead of doing lecture stuff. Lecture wasn't required for me to attend, and it got I felt like I was getting I was doing fine on the weekly quizzes. Like the first few weeks of a block, it would be like a little lower, but by the end, because I was compiling all the Anki and actually moving ahead, by the end I was performing really well. So just worked for me. You just have to find a groove, and then if you can, you just need to learn how to take breaks. I think that's a problem with a lot of medical students. We don't take breaks as often as we probably should. Yeah, multiple choice questions, Anki flashcards, and then boards and beyond and all that stuff. See ya, Abdi. Thanks, man. We'll see you later. What's your graduation? Have you ordered your embroidered figs? No, I'm not a figs guy, Riley. I'm a Code Next influencer. That's like car beauties and Meta Bros' like scrub brand. I'm affiliate with them because they're med school YouTubers and they seem pretty cool. So I decided to do that instead of doing the scrubs. So I will not have embroidered figs. It took me a while to get that. I was like, "What are you talking about?" But yeah. That where they disappeared too. Yeah, they haven't made a video in a while. Med Bros, he was gonna make he was talking about making a video soon. I follow him on Instagram. I forgot his name. Not Charmin, but the other dude. I think he posted it. He's gonna post soon, maybe. What specialty, in your opinion, do you think is the hardest? Oof. I don't know. They're all hard in their own ways, honestly. Um, nah, I don't think vascular surgery. Yeah, honestly, that's a good way to put it, Riley. Whatever you're least interested in, I think that's a good way to put it. Yeah, I think that's valid. Vascular surgery, I don't think seemed that hard when I was hanging out with the cardiothoracic surgeons. Like, obviously, it's hard, but it just didn't impress me like the hardest specialty or anything like that. Really cool, really bloody, but eh. What'd you do? What research did you do? Yeah, especially at like level one trauma centers, people would come in with gunshot wounds all the time, and then we have to go explore and make sure like it didn't rupture a blood vessel, an artery somewhere. Um, and then it would suck whenever you would get down and actually like no damage happened, which is good, right? But you just spend all this time, and then you get gowned up because we were concerned there was COVID. So we were like gowned up, all this stuff, like all these hours to get down to realize like there's no damage to this like dude's vasculature. That was always really fun. Yeah, I loved trauma. General surgeries got really boring for me after a while. I thought it was kind of cool that some general surgeons specialized a little bit, like because they were a little bit older school, so they like not like specialized. They just were able to do more procedures and um, like lumpectomies, like lumpectomies for women with breast cancer. Those were really cool surgeries. I thought those were really cool. Um, but like appendectomies and like gallbladder removals, I thought were whatever. I worked with a cardiothoracic surgeon out there, and we actually did a lobectomy, which was really really cool. Literally cracked the chest, like actually got to touch like a moving lung and take it out. That was pretty insane. But then like everything else was just like, yeah, whatever. A lot of incision and drainage, INDs, whatever. Yeah, hernias. Yeah, yep. So hopefully, Diana, the plan is so this residency that I will be going to is fellowship equivalent. So the plan is that by the end of my third year, by the time I'm done with residency, I should be able to sit for family medicine and OB boards. So hopefully I'll be done in 2026. Hopefully I won't have to do that one extra year. That's like the plan with this program. If I have to do it, I have to do it. But a lot of people have graduated from this program being able to do FMOB, and that's the plan. That's the dream. Yeah, yeah, exactly right. So that's like this. It's just OB, right? Like no gyne. It's just OB, just like for the C sections and high risk pregnancy management, basically. And then like a little bit of like PICU, NICU kind of training to stabilize, the babies that you pull out. But that's kind of yeah, exactly. So it's FMOB, not FMOBGYN. It's just FMOB. Um, that's kind of how it's structured. And basically, Riley, so yeah, it is busy because family medicine residencies generally, like your first year is your busiest, second year a little bit less busy, less inpatient with more outpatient, and then third year less inpatient, more outpatient. But this program has a specific like track where you do an advanced maternity care, and basically your second year you are on call to be a primary assist on the C sections, and then your third year you graduate to being primary surgeon on all the C sections. Um, I don't have an exact number, Riley. It is posted. I could probably find it, but the average at this program is 140 C sections. Most rural hospitals will give you privileges to do C-sections if you do 40. And this program, you do 140. That's like average, with like an average of 300 like vaginal deliveries. But that's like whatever. But yeah, C-sections, you need a good amount. So sorry to know the difference. OB is birth. Yeah, so basically, Diana, like OB is just like labor and delivery. Pregnancy, prenatal high-risk pregnancy, if they need to do C-sections. And then a part of it is like management and stabilization of a like newborn infant that may need to be intubated and stuff, kind of things like that. And gyne is more, like repro, like hysterectomies and stuff, more specialized procedures down there. Basically, a surgeon. Yeah, exactly, MX. General surgeons perform C-sections. I have never seen a general surgeon perform a C-section or heard of one. They kind of stay away from the uterus, but whenever we are getting close to, like if we damage the gallbladder, if we damage the bladder, or we're concerned that we might have injured the bladder whenever we do a C-section, generally we'll call in a general surgeon to like consult in the OR. If we did, they'll fix it for us. But generally, they kind of stay away from the uterus. I don't know. I wonder if that's a thing they can do. Probably not, honestly. Thank you. Took an education. Yeah, it was good. You were right. Like that's basically it. Yeah, I love labor and delivery. I love delivering babies. But outside of that, like all the gyne procedures, probably because I'm a guy, that I just don't enjoy them too much. And I feel like women aren't as comfortable. I'm not that comfortable. Like if I need to do it, then I'll do it, kind of thing. But it's not something I want to train specifically in. Any tips for doing well in OB rotation? That's my last clerkship this year. Yes, Riley. So if you want to do well on your OB, I mean, kind of depends on if you like delivering babies. If you like delivering your babies, so what I would do is I would show up 1 hour every morning before the interns on my sub-I. I would show up 1 hour before them. I would get like all my pre-rounding done like super early. That way, like my morning was a little bit more free. That way, if like a laboring mom came in or whatever, like I would go introduce myself, like, hey, like my name is Aaron, I'm a medical student. I really love OB, and I see myself doing this. Like, is it okay if I'm here during your delivery and help out? Usually they'll say yes. Tell your resident, like, hey, I want to catch a baby. Like, that's one of my goals for this rotation. So every time you go into a room, grab or have a pair of sterile gloves, like in your back pocket, your size, like just always have them on you, just always. And then like during a labor, if they're laboring, you stay there, you support the mom, all this stuff. And then once, like, sometimes, if you get a good resident, they'll like put you, at the helm to catch the baby if it's a low risk delivery. But if it's, if they don't, once the baby crowns and like the head is out, like go ahead and put on those surgical gloves. Like don't, like kind of as, like get a feel for like how it's going in the room. But at that point, like put on surgical gloves. That way you can help like deliver the placenta, or hand them like the clamp for the umbilical cord if they need it, if they need like the tube of blood. So like just be prepared to do that. Like after your first one, you'll kind of know what I'm talking about. But there's like a process. Once you deliver the baby, you kind of put the baby on mom's chest. They wake baby up, dry it off, make sure it's okay. And then the umbilical cord, you kind of hold on. You don't hold on to it, but you can see when it stops pulsing, like it's done delivering blood to the baby. You don't want to cut it early. You kind of wait for it to stop pulsing. Then you can clamp it. And then sometimes they'll have you cut the umbilical cord like in between the two clamps. Always remember that. Sometimes they have the dad do it if he's in there. And then from the clamp that's still attached to the placenta, then you need to get a little bit of sample of blood into a blood tube for the lab. And then whenever you deliver the placenta, like be engaged and like flip it over and make sure that there's 3 vessels on it. It's hard to see initially, but you can see if there's 3 vessels on the placenta, that means it's normal. And then you want to examine the placenta to make sure there's not chunks missing, because if there are chunks missing, then they might be retained, and that is a big risk factor for infection, continued postpartum bleeding, hemorrhage, and you might need to go, looking for it. And then also, the further you get in and the more they trust you, they might even let you suture like lacerations that happen. So brush up on your suturing skills. Know, just how to do a simple. I got really good at the one-handed knot. It's my favorite knot. When I was in surgery, I thought the two-hand was better, but the one hand is way better. But a simple instrument tie is always good too. Yeah, a lot. That's a lot, but that's kind of my. Yeah, I killed it on my sub-eye. I delivered many babies, and I repaired a super complex left and right perineal laceration. So it was crazy. And that was in one of my letters of rec. And I only know it was because it happened. And then some interviewers asked me about it, even though I don't know what my mentor wrote about it. She was super impressed with me being able to do that. So that was fun. Running no, it's literally just regular sutures to fix like lac repairs, depending on what the tear looks like and how it is. Yeah. Yeah, see, I still remember a lot, which is kind of crazy. Like talking back about it, I was like, dang, I was like in my head just walking through all the steps. Yeah, simple interrupted works, exactly. And then also sometimes like with perineal lacerations, sometimes we do like the locking knot. Like it's kind of like a running stitch, but you lock it. It's a little bit more advanced. I'm not amazing at it either. But that's one that they liked. I don't know if you could like look up a YouTube video. You're probably not gonna do one of those. Probably not, but if you do, like you'll look awesome. And that's more for like larger, longer lacerations that occur. Dang, yeah. Here's another good session. 35 minutes in. That's cool. Did you do an emergency medicine rotation, Riley? Or like I never did a specific emergency medicine rotation. Like the people that want to go into emergency medicine kind of have to do a sub-I in it. But I don't know if that's like a required rotation at your medical school. Is it or not? Like I did do ER when I was in that rural hospital, but not because it was like part of a rotation, just because it just happened to happen that way. But I don't know if you have like a required third year emergency medicine rotation. A two elective EM rotation not required for us. I did one after first year. Oh, nice. Yeah. Okay. Yeah. I was just wondering if it was like a standard one. Sounds good. One of my friends, he did an emergency medicine, like a sub-I, I think he went to Denver, and he really liked the Denver program. He stayed here at University of New Mexico for residency. He matched here. That's where he wanted to match. But I remember him saying that I'm pretty sure it was in Denver that he thought it was really cool because they seemed to like actually have like money and being able to take care of patients, which was really nice. I don't know the EM world though, like what competitive programs are and things like that, but I do remember he liked that. Where is it? Thing is, there are 3 and 4 year program. Denver is a 4, but UNM is a 3, so maybe that contributed. No, I mean his wife matched into fellowship here. She's doing gynecology oncology, gynonc, I'm pretty sure. So and he has a baby and she's pregnant. So yeah, obviously he really wanted to stay here. I think that contributed more to his decision than um, the program length, but I don't know the specifics. So far, would you say medic school is hard? I think the first 2 years are really hard, and then after that, like third year, I loved clinic. I loved going to hospital and actually doing medicine. So it wasn't as hard, even though it was a lot more hours. But I think the preclinical years are way harder. I don't know Riley's experience. Uh, Huge time sink. Yeah, it does suck whenever you're like, yeah, when you're done with your work for the day, but you're just sitting there waiting to be dismissed. That was pretty annoying. That was the worst part for sure. Mm. Just making my own schedule and doing the virtual COVID years of med school. Oh man, nah. I mean, it was kind of nice just like being able to do school from home. I always would go to coffee shops to study, but then COVID hit and I kind of stopped going to coffee shops and just studying from home. And then at that time, my wife, she was doing text. Like first, she was doing basic training, and then she was doing tech school. So right before COVID hit, I was able to really focus because she was at basic, and then at some point during COVID, she was doing tech school. So I really lost myself in the studying. Like I just doubled down, and it was unhealthy, but I didn't have anything else to do. So it kind of worked out for me. But I feel you. It was nice, like having your own like rhythm day in and day out. Hmm. despite like I'm trying to make myself useful, still feel like I'm just in the way during third year, and that's just extra work for them to have a student. Thank you so much, MX, for hanging out. We'll see you later, man. I appreciate it. Go watch like my YouTube short that I made, like the different Valley Med fellowships. Only a minute. Help me out. Yeah, I felt that a lot too, Riley. Like it sucks being a medical student because you are like trying to impress your, like you're attending more so your residents. You're trying to be useful, but it sucks because you're out of the loop. Like whenever they get nursing pages or messages, like you don't know right away, and it can just be really hard and burdensome. You're tired. Like no one's communicating with you. Like whatever you say doesn't matter because they'll either accept it or reject it. Yeah, it is very exhausting. I totally agree. I share that sentiment a few times, so I definitely feel where that. I see where you're coming from on that. Doesn't feel good. Where did my chat go? Hold on, my chat got lost. What the heck? Oh, there it is. I don't know if I closed it or if it closed on itself. I was like, I don't know if I missed a question. Sorry if I did. I don't see any new questions though. Do you have a like a partner, Riley? Like why the housing question? Just like wondering or what? Yeah, as soon as when I matched, I felt a lot of stress decrease. I felt a lot of stress decrease like when I found out I matched, but when I found out where I matched, like I am on top of the world ever since. Like I am on a high since. Caleb, thanks, man. Respiratory therapist, but I want to be a doctor. Oh man, how old are you, Caleb? There's still a chance. I had a classmate that it was her second career. Respiratory therapist, super helpful in the ICU. You guys were some of my like best teachers in the ICU. I love respiratory therapists, and yeah, I'm nothing but good things to say, except for whenever it is peak RSV season with the peds kids, and you guys are being overworked, and we're overworked, and like emotions run high. But outside of that, you guys have been awesome on the ICU teaching me. And one time I had such a good experience with the respiratory therapist. I was in the ICU, and it wasn't a COVID patient, although it was respiratory failure of some sort. And my attending was pushing me, and so what happened is my attending told the respiratory therapist to make me decide what we wanted to do with the patient because she wasn't going to tell me. And so when I presented my patient, I think I said something like in the plan, it's like multidisciplinary rounds, like the respiratory therapist is there, the pharmacy, like the other med students, the residents, the attending. I think I said something like, I think we should, I think it was switching from like, I don't know, they were like on like 3 liters, but I wanted to increase to 15. But I think you guys need like a specific, like another, like I forget the term of what it is, but I said it like kind of like that, like I think. And then the attending, she was scary. She intimidated me, and she's like, make a decision. Like straight up told me make a decision, and I was like, okay, I think we just need to. Or I just said like, let's increase it to 15 liters, and she's like, okay, and like let's move on. And it was like so crazy. Like that was one of the first times she let me make a decision in the ICU. And I only felt comfortable because in the morning when I was pre-rounding, I had talked to the respiratory therapist, and you guys were the ones that actually told me like, hey, this patient's not doing good. We probably should increase. So it was you guys that made me look good. So thank you. So many stories. But yeah, Riley, absolutely. Yeah, my stress levels decreased so hard after the match. My stress is a little bit high now because of the housing situation, but outside of that, it's okay. I feel like I'm riding a high right now. Yeah. In 28, and I traveled. The medical has been good to me, brother. Yeah. That travel pay is awesome. That's awesome. Hey, Caleb, speaking of travel, do you? I was telling Riley that I'm looking at probably doing and living in a fifth wheel. I know a lot of travel nurses live in fifth wheels and stuff. Like whenever they do travel assignments, I don't know if that's something you have done. Because I'm looking at buying one, and I don't know if you've lived in one. Just random, not really random question, but prompting question. How about that? Not me personally, but I hear it's popular. Can really cut down on costs. Yeah, that's kind of the plan, like to cut down on costs because rent is kind of high. Um, Airbnbs, not in Greeley, they're kind of pricey. Where I'm going, so that's not really an option. I'd rather just get like an apartment, honestly, at that point. But I like the RV idea because I'm probably only going to be there for like 6-8 months, and then we're going to buy something. So I also didn't want to lose like all my rent money to rent. And yeah, I'll still have like a RV payment or whatever still, pero gracias, Diana. Nos vemos al rato. Let me know if you have any questions ever, and I'm here. And that's kind of my thought. Like a fifth wheel payment is like 300, like on the lower end, and RV park rent out there is actually kind of high, like 700. But then like even if it goes up to 800 payment on an RV, that's way cheaper than like a $2,000 apartment. See ya, Riley. Thanks for hanging out. I appreciate it. Whoa. Sounds good. We have to consider long-term payments on RV after. Yeah, that's kind of what I'm saying. Well, it's for residency, Caleb, right? Like I'm gonna be there forever. Like like I said, like a $300 payment, or up to like afterwards even 800. Like it'll still be there, obviously, but at least I won't lose all my money, and then I can maybe just resell at that point and see if like make some of my money back, just get rid of that loan or whatever. Where do you travel the most to, like as a respiratory therapist? Where are like some of your like what states are requesting you, like or paying you more, or states that you like working for, kind of thing? Holy cow, in Alaska. Are you originally from Alaska? New Jersey, New York is high paying. Nice. Um, Dang, Alaska's awesome. Mississippi. Oh man. I visited Mississippi when my wife was in tech school actually. I It was really good. Like the seafood was good, but it was like kind of muggy. And then I stayed at a really cheap like motel, and it was awful. But I really enjoyed it outside of that. Like I love the seafood. Um, it was all right. I mean, I was only there for like a couple days or like a few days, so it's not like spend a bunch of time there. I might have found a fifth wheel. That's what I'm messaging a lady about right now. It seems a little bit scammy because the price is a little bit low, but I do know that people, sometimes they just want to get rid of them. So it's not just sitting in in their yard doing nothing, rotting and just depreciating. So maybe I might have a really nice fifth wheel for cheaper than I could find anywhere else. Working barrel last all the way to the top. See, after already good apply for. Yeah, rural practice, Caleb, is awesome. I love full spectrum medicine. I did a bunch of rotations in rural New Mexico because yeah, I think it's awesome. I think it's badass. And most like places that family medicine residencies are, you can do the loan forgiveness, but I don't have that much loans in comparison to a lot of people. So the plan is to still live pretty frugally, and then hopefully, like within the first year or two of practice, I just pay off all my loans, and then we enjoy life after that. uh, Family medicine, Caleb. Cool thing about family medicine is you can work in all of those settings too, like rurally. So that's honestly true. That's also why I did. Yeah, I could have gone to Barrow. So Alaska has probably the most um, frontier medicine residency program in the country. Obviously, because it's Alaska. It's a family medicine residency. Basically, like it's just so cool. Like they literally have like little biplanes that sometimes you have to get on and go stabilize a patient and who knows where in the middle of Alaska, like fly them back and you're like the doctor doing that, which I think is awesome. I didn't apply, which is it's funny because I think of myself as like a rugged dude, like all the wilderness camping, like hunting, all that stuff I've done. But I was like, dang, Alaska just seems a little bit more, just seems rustic. I know it's super like the nice places are developed and everything, like Anchorage, Alaska, but I don't think I wanted to like move over there for residency. So I didn't apply, but I've heard really good things about the program there. Yep, we do that. Call it medevac. We have big swing and helicopter. That's what I was told. Like I don't know, but I just heard. I was like, that is badass. That's cool. That's just straight up cool. Not much scenery we are at all. We serve a small native village. Oh, it's interesting. How like where? I guess I'm just gonna Google it real quick. Like where Barrow is, um, like in relation to Anchorage and stuff. Utjavik, Utkivik, Alaska. Utkivik, Utjavik. So you're like like northern Alaska. It looks like, Caleb. Yeah. Wow. Okay. Samuel Simmons Memorial Hospital. Cool, man. Yeah. I mean, I don't. I mean, I don't know any. I've never been to Alaska. I don't know anything, but um, like now looking at it on the map, I was like, dang, Alaska's big. Like, I know it's big, but dang, like it's a big boy. Yeah, Anchorage is literally so you're literally at the peak up there, and Anchorage is literally just down at the bottom. Do you have like a family, like a wife or kids or a partner? I guess Caleb is a better question. I'm like looking at the little city. Where is the hospital? Let's see. I see a school. I see a Napa. Oh, there it is. I see it. Dang, that's cool. Is there like a lot of ice fishing and stuff like that? Like I love fishing. Alaska's I always hear about like the whole salmon fishing out there. But obviously I've never been, so single and free. Well, I mean, you're young, man. 28. I'm 28 too. We're both 28. Uh, that is a prime age to be and to be making bank. Good, good, good stuff. Yep, in the native villages, ice fishing and whale hunting. Oh wow, whale hunting, dang. Uh, yeah, I guess that's still a thing, huh? That's cool. Got to be careful of polar bears too. Are they like aggressive too, or is it like is like food scarce that they are aggressive and hungry? There's like a lot around, or how's that? No, man, I'm gonna get GERD with this coffee drinking it so late. What about a polar bear attacking whales and a mother and her child in front of the elementary school? Holy cow, that is insane. Did they kill the polar bear after that? Like, wow. Yeah, that's crazy. Right? Like I feel like people don't understand like that's still a thing that happened in the world. Like just Americans in the city just have no idea what that's insane. Village, we try to drive them away, but sometimes we have to kill them if they get too close. Dang. And is it just like polar bears too? Like I've also heard, like the rumors and stuff where like polar bears are mixing with grizzly bears and stuff like that, or there I assume they're probably all polar bears. Snowy owls, Arctic fox, and muskrats. Oh, I love watching those documented Arctic foxes and seeing them jump to like get the mice or the rabbits and stuff. That's all I think. They're so cute. I also love snowy owls because of Harry Potter. Yeah. That's cute. Don't get close to those boxes. Some of them are rabid. Dang. Aren't they pretty small though? Or right? Like they're probably pretty small. Is there like rabies and stuff out there, like with those foxes? Small plastic, just one of our doctors on one occasion. Yeah, I was like, I've seen pictures of them. I feel like I could kick it away or get it away from me at least, but I don't know. Like, animals are animals. Oh, thanks, Caleb. We'll see you around. I'm probably gonna end the stream too. I usually make them go for 1 hour. It's been going a little bit longer. Yeah, thanks for hanging out. Enjoy my newsletter. Watch my other videos. You can always send me an email back at the newsletter or whatever, and we'll see you all later. Thanks for hanging out with me.